place engagers on patient's teeth, you will need a scaler, an engager template, cheek retractors, a light curing gun, acid edge composite, flowable composite, and a bonding agent. You may also want to coat the engager void with petroleum jelly to make the template easier to remove the Odonto Engager template trim line. Prepare the tooth. First use the cheek retractors, then try on the template. Identify the location of the engagers. Use the acid to etch the tooth wherever engagers will be bonded to the teeth. Do not etch the entire facial surface of the tooth. Thoroughly rinse off the acid. We recommend using low heat to dry the tooth. Preparing the Odonto template. Fill the engager voids about 2/3 full with the paste type composite first, and then top off the final third with flowable composite. Apply the bonding agent to the tooth. Make sure the tooth is both etched and dry before applying the bonding agent. If indicated for the bonding agent, use light cure to bond the agent. Place the template back on the patient's teeth and light cure the composite inside the template. Finally, remove the template. You can use the scaler to help remove the template and clear off any extra flash material. Your final result should look something like this. Your patient should then try on their new set of aligners at this point. Check the fit of the aligner to ensure that everything is seated properly. If you notice any fitting issues with the aligner, be sure to troubleshoot to Odonto accordingly. Here are some few tips lined up by Odonto to help make the bonding procedure easier. Tip number 1. You can lightly coat the engager void with petroleum jelly or mineral oil to help with the removal of the engager template after light curing. Tip 2. Before placing the engagers, you can trim the engager template, which can sometimes make placing engagers easier. Tip 3. Before filling the engager void with composite, you can create a hole in the engager void using a scaler, which allows some composite to release. Number 4. You can use a finishing burr to smooth and clear off excess flash. Be sure that you don't polish the engager, just remove the flash. Removing engagers. Engagers can be removed once they're no longer needed for treatment or at the request of the patient. If a patient requests early removal of their engagers, be sure to inform them that their aligners may not move teeth as well as expected without them. What will you need? For removal, you will need a high-speed handpiece with water irrigation and a multi-fluted composite finishing burr. To remove engagers, use a high-speed handpiece with water irrigation and a multi-fluted composite finishing burr to grind off the composite. After removing the engager, if needed, we recommend you clean and polish the tooth surface.